are medical groups preparing for the surge in COVID cases? Well, joining us now is Dr. Maricar Limpin. She's the president of the Philippine College of Physicians. Good morning, Doctora. Thanks for being with us.
Good morning, Ria, and good morning to everyone.
Now, Doctora, we are 3 days away from shifting back to the strictest form of lockdown. How necessary is it to reimpose ECQ in Metro Manila?
Well, as we have seen in the past, putting the a place in lockdown will definitely hamper or prevent the rapid transmission of COVID-19, and this has been very evident, even from the past. Every time we go back to a lockdown or even just a mere MECQ, it does really help in preventing the transmission of the disease. But then again, for us medical practitioners, we would like to see a more permanent and more effective containment measures, like the establishment of a real permanent and standardized contact tracing, wherein after you can easily trace who among the people would probably have the exposure to a COVID-19 confirmed patient. And then once you have actually traced them, contact them, and then put them on isolation immediately and do the necessary test at the appropriate time.
Because we just heard a report earlier about how businesses are affected by lockdowns. And we'd like to get your reaction on some sentiments of various citizens, whether they are small business owners or not, na hindi na lang laging lockdowns ang solution dito. There are other things that we need to do. As you said, apart from contact tracing, what do we need to do more of, considering health professionals are saying that with the Delta variant, this is a different game?
Yes, we need to really make sure that the minimum health protocols, we have been saying all along, and that will not change. It will still be the most effective strategy to do in the containment of this pandemic. Even if we have the Delta strain or even other strains for that matter, what is very important is to strictly implement health protocols. And when we talk about strictly implementing health protocols, it means that we have to do this regardless of whatever community quarantine measures is being applied. Kasi ang problem natin, Ria, once we relax a little bit, kunyari from ECQ, mapunta tayo sa MECQ and then GCQ, we also see relaxation in the implementation and how people comply with the minimum health protocols. For the past weeks, when the NCR was placed on GCQ, we see that many of our Filipinos are not following health protocols, particularly the proper way of wearing your face mask and also maintaining physical distancing. In fact, if you look at all the places in the restaurants, even in restaurants, you see more than 50% capacity. Mm-hmm. Even when what is being implemented, what should have been implemented is just up to a maximum of 50% capacity for the dine-ins, pero lumalabas hindi siya 50% lang, mas marami pa sa 50%. So I think we need just to really be strict, particularly in implementing the health protocols and some of the policies. And this is where we need the help of the local chief executives. Kasi depende usually kung saang LGU. So may mga LGUs maganda, may LGUs na hindi maganda. So yung mga LGUs na hindi magaganda, we are calling them. Kasi sila talaga yung nagiging dahilan kung bakit padami ang nagkakaroon tayo ng kaso ng COVID-19.
That's right. It really boils down a lot to the implementation. But for you, Doctora, do you think a 2-week ECQ is enough to contain the spread of the Delta variant, or do you feel that this is something that might need to be extended? And in view of this, kamusta na po ang moral ng mga healthcare workers?
Well, just to let you know, no, the problem of this pandemic is not just confined in the NCR, because we have been seeing, like in Cebu, many, if you look at the hospitals, they're private or government, nakalinya ang mga tao, ang mga sasakyan, nakalinya, naghihintay for their turns to be taken care of. And then may dala-dala na silang sarili nilang mga oxygen tanks, no? So really, this is very alarming, for us health practitioners to see this happening right before our eyes. Talagang nakakakilabot. And then we see Ilocos Norte, talagang up to the brim ang kanilang mga hospital, no? So napakahirap. And we have actually been preparing for this, no? Even as early as 2-3 weeks ago. We are preparing for this increase because we know it's going to happen, and yet we don't know. No, I am hoping that with this lockdown we will be able to contain. I think the 2 weeks will be enough, kasi baka masyadong pag nagtagal pa tayo, talagang mahirap na para sa mga kababayan
That's
natin.
right.
No?
That's right.
But
Thank you, Doctora, so much for your time. We appreciate that. Philippine College of Physicians President Dr. Maricar Limpin.